Hi, I'm Dr. Petty with Carolina Chiropractic. Today I'm here with a patient who has shoulder pain, who has been a cook for many years and has recently developed some shoulder pain, as well as he has some other aches and things. Do you want to talk about what's going on, or do you want me to do it?
Just a couple weeks ago, just general work, long hours, pretty much woke up with, I guess, an inflammation in my shoulder and just agitation. It just basically discovered I couldn't put my hand in my pocket.
Okay. Front pocket or back pocket?
Back pocket.
Okay. All right. So I'm going to show you a little bit of range of motion. I've actually already done a full exam on him. So when I get to here, he's pretty good there, but you can see in his eyes it starts to grab him, whereas he should get a little bit more range there. When we come back here, that's where it really gets him pretty good. And then when we do external rotation, if I go any further, he'll start saying some fun words. Then when we come down here, not so bad, but still not so great, you can hear it. And with the mask on, with COVID going on and everything else, it's harder to read expressions. And then right here on your pectoralis minor, you got a lot of tenderness, right?
Yes.
That was the spot that you knew was there.
Yes.
And then we were back here on infraspinatus, which is just a muscle on the shoulder blade. You hadn't even touched this one. You didn't know that was at all sore or tender or anything like that, correct?
Correct.
Okay, and then there's a little teres minor that's out here that's quite tender as well. And those are part of the rotator cuff. And so I think that you said you just woke up with it. You didn't do anything.
That's what it
crazy.
seems like. The day I noticed it, it was just yet the day before it was fine, the next day it was off.
And you're right-handed?
I'm right-handed, yes.
Okay. All right. So you've never been adjusted before, correct?
Not in many
years? Okay. All right, so this is the first time I'm seeing you. So what I'm going to do is I'm going to adjust your shoulder first, okay? You might want to come this way so you can catch a closer look and all that fun stuff. We're going to bring this arm in here, okay? Keep it in close. Doesn't hurt like that, right?
No.
I'm going to pull back like that, okay?
All right.
But what I'm going to do is I'm going to take my nice wingspan, reach around, and kind of pull back and just relax, right? Good.
New.
You okay?
Yeah.
Okay, all right, relax it. A lot higher.
All right, that's where I'm feeling tension way back there now.
But also getting more range of motion out of it before you ever catch
Yes.
it. Right?
Yes.
Good. We're getting there. I'm not done yet. I'm going to do one more move. How painful was that when I did it?
A 3.
A 3? Okay. All right. You just made a little reaction.
This actually hurts worse right now.
Right, so I'm not going to do a whole lot here. I'm just keeping it loose. Okay. So again, just kind of double checking after it. A lot more range of motion. A lot less pain and whatnot. Lie on your back with your head right up here if you don't mind.
I'm going back with my head up here.
All right. So we didn't take x-rays because I believe most of it's soft tissue. I'm sure that there might be a little bit of arthritic change in there, but that wouldn't really change my diagnosis much, nor would it change what I was going to do with him today because this is an acute flare of it. So what we're going to do is we're going to get in here and kind of work your pectoralis minor. If it's too much, you just say the word, okay? I'll back off.
All right.
Whatever that word may be, that's all PG rated and can be on YouTube, okay? You okay?
Mm-hmm.
Good. This is tender, but what I'm about to do will be a little bit more tender. I'm not gonna lie to you. You okay?
Yeah.
Good. All right. So this is what I was telling you is gonna be pretty tender here. All up in. You all right?
Jeez.
You okay?
Yeah.
Scale of 10, how bad is that?
That was an 8.
Okay, all right, that's what I need to know, because I need to know how much I can push, how much I can do with you, and how much I can't do with you, okay? So I'm getting up here in this muscle. It's called subscapularis. It is underneath the shoulder blade, and just kind of working it. It is also one of the 4 muscles of the rotator cuff. The only one I haven't listed is supraspinatus, which sits on top up here. But you okay?
Yeah.
Because I can see like you're holding your breath a little bit. So I know it's intense. Okay, good. we're gonna kind of take right here on your AC joint, your acromion clavicular, and just kind of relax right here, nice and easy. Kind of put a little impulse on that joint. You okay?
Yeah.
Good. Roll over to your stomach for me if you don't mind. Before you lay down, since I got all the way up, move that shoulder. Tell me how it feels.
Crunchy.
Okay. Can you put your hand in your back pocket yet or no?
Oh, definitely more
It's
movement
better.
back there. I can actually
Yeah.
almost touch the other side.
Okay. All right. Lie on your stomach for me. We're getting there. If you need to take that mask off while you're laying down, droplets fall, they do not raise. So what we're gonna do is I'm gonna show you a couple of things here. So teres minor kind of comes right off the edge of the shoulder blade, the little bone here. And what I'm doing is just kind of doing a little bit of muscle work. And then infraspinatus, so the spine of the scapula comes down here, or the shoulder blade, and then it's divided into infraspinatus and supraspinatus. And infraspinatus is the one that he had no clue how tender it was through here. What we're gonna do is, again, just tell me if I need to back off, because I know that that's sore, I know that that's tender. It's been compensating, and the axillary nerve runs out right through here, and that's where he's getting some of that pain and some of that. You're not getting any numbness, are you?
Actually, yes.
Are you?
Yes.
Okay. I'm gonna hold this for 5, 4, 3, 2, 1. Just a little ischemic pressure there. You okay? You can breathe now again. That was tough, wasn't it?
Not the easiest thing I've ever done.
Now your wife is videoing this, so if you just see where I'm pushing, you can get all kinds of secrets out. I'm only kidding.
Okay, I get it. I'll go.
Okay. Now I'm not putting much more pressure than that, on there. It's pretty tender, right?
Yeah.
Oh yeah.
So what we're gonna do is we're gonna put your hand now up on top of your head, kind of. Okay? No, it doesn't have to be on. I just mean above. That way it stretches the muscle a little different and bellies it up a little different, so I can work it a little bit different.
Oh.
You okay?
Yeah.
Again, I'm not doing much more pressure than that.
I
If you need me
know.
to back off, you tell me to back off, okay? All right. So I'm gonna adjust the rest of your body in just a second. But you okay here? Which is worse, this or up here? 1 or 2?
2.
Okay, all right, relax. I got you. So what we're gonna do now is I'm just gonna lower you down just a touch so I can adjust your mid back. You're gonna take a deep breath in for me and all the way out. I'm gonna push in here. You feel it pop. That pop is called a cavitation. It's a gas release in the joint. How'd that feel? Weird, different, painful, good?
All.
All? Okay. All is an acceptable answer.
I'm taller.
You think you're taller. You are. All those years of being a cook and bending over at the mid-back, poor posture and such, you start to kind of bend your spine and lose a little bit of that height. And then all of a sudden you stand up and people all the time tell me, I feel taller after an adjustment. And you are a little bit because you're all of a sudden standing up straight. Breathe in again. This one won't be as tender as that one was. All the way out. Good. How was that?
I was okay.
Okay. Because it's usually whatever needs it the most. So what we're gonna do is we're gonna bring it right there. We're gonna put your hip right here, nice and easy.
Oh.
Good. You okay?
Jeez.
That's the good stuff right there.
Good. All right. Roll to the other side for me. Now your wife's the one that referred you here, so.
I'm not complaining. I knew this wasn't necessarily going to be comfortable. It's been 30 years, I think, since I've had a back adjustment.
Well, and I will jokingly say it's like taking a splinter out. Sometimes when you take the pressure off the nerve or you line things back up, it hurts a little bit when you do it, but then it feels better. It's like, oh, I got that thing out now. Relax right there, nice and easy.
Oh, that's the good stuff.
Good. Lie on your back for me.
I can already tell that it's doing much, much better because I can lay my arm down like this and it's not hurting.
Okay. All right, we're just gonna take a little impulse here. You're gonna just relax, nice and easy. Okay.
Oh, that was different.
Okay.
I've never had that done before.
No? You know that other chiropractors never adjusted your neck like that?
Oh, or my soul.
Or your soul? Okay. All right. Did it hurt?
It just feels weird.
It does feel weird. I'm not gonna deny that. There's a new sensation. You want me to do the other side or you want me to leave it alone?
Oh, go for it.
Okay. All right. Just relax right there, nice and easy. Good. All right. I'm gonna help you up. Move that neck around. That's tight.
Groovy.
Right? Let's move that shoulder. Tell me how it feels.
Nice.
Couldn't do that before, right?
No, I couldn't touch both hands behind my back before.
Mm-mm. Okay. All right. Stand up. Tell me how the back and everything else feels too.
Oh, my feet feel different. Seriously, my feet feel different.
Because you can feel them better, probably.
They don't hurt.
Well, good.
This is the first time I've been barefoot on the floor in how long, honey?
Quite a while. Never does it.
And this doesn't hurt.
Yeah. Good. All right. Sit here. I want to talk just a couple of things on that shoulder, if you don't mind. Stand moving a little bit better. All right. We're gonna bring you back. Not even catching on you, right?
No,
Good. All the way up.
I'm not even getting the grinding and popping sensations.
There's
There's
definitely
one.
some clicking and popping, and we can KT take that to make that feel a little bit better. I have other videos and stuff that do that as well, and other techniques. But that should feel in that shoulder a lot looser, a lot less catch.
I came in with like a constant on a pain scale, I'd say 2,
Mm-hmm.
with spasmatic up to 8, just depending on how I moved. Now it's nothing.
And then when you move it, and it's like
It's
challenging.
like I can feel a little residual, but I mean it's, I can now.
The residuals,
Yeah.
what number would you say?
0.5.
0.5? Excellent. Great. Wonderful. Thank you for volunteering to be on my YouTube channel, and subscribe, like the videos, and keep watching. Thanks.
I'll be back.
Bye.